So we've described the benzodiazepines, we've described the benzodiazepine receptor agonists, or the Z drugs, all of which act at the level of the GABA receptor and augment the activity of GABA. Now, there are other groups of agents which have been introduced which don't act at the GABA level at all, but act at the wakefulness level of the wakefulness system. These are the drugs which antagonize wakefulness neurotransmitters. For example, Doxepin is an antihistamine. Doxepin at low dose, 3 or 6 milligrams, is a pure antihistamine and diminishes the histamine wakefulness drive and therefore can produce sleep. It's indicated for maintenance insomnia. The American Geriatric Society has recommended that it not be used at doses above 6 milligrams because it seems that that drug tends to acquire anticholinergic properties at larger doses and may produce memory decrement and other problems if used on a long-term basis. So 3 to 6 milligrams of Doxepin. The other drugs which also can be that are interesting in that they do not have a GABAergic mechanism are the melatonin drugs. Ramelteon, for example, is a melatonin receptor agonist which is indicated for sleep initiation insomnia or problems falling asleep. That drug is available 1 dose, and that's 8 milligrams. And it's also interesting in that it does not seem to have any addiction potential, much like Doxepin. And it also has a safety profile which is unparalleled in the sense that larger doses don't seem to have much in the effect of respiratory suppression. The melatonin receptor agonists may be appropriate for patients who have significant drug addiction histories as well. And finally, the Orexin receptor antagonists. As I mentioned before, the orexin system seems to be responsible in promoting arousal or wakefulness, but also in terms of regulating the transition between sleep and wakefulness and ensuring a stable relationship between sleep and wakefulness. The agent that was introduced and has been available by prescription is suvorexant. Suvorexant is a dual orexin receptor antagonist, and it has been studied in patients for as long as 3 months on a long-term basis and seems to be effective and is indicated for sleep initiation and maintenance insomnia.